Hello everyone, welcome to Panda Finance.
Today is Monday, April 1st, 2024, Beijing time. Duan Tao, a professor at the First Maternal and Child Health Hospital of Shanghai, has been engaged in obstetrics for over 30 years. At the end of February this year, he posted an article titled Save Obstetrics on Weibo, stating, "If the current situation doesn't change, the entire discipline of obstetrics might really be finished." Duan Tao's Weibo received thousands of comments. Duan Tao mentioned that recently, some directors of obstetrics in Shanghai's Pudong New area gathered for a meeting to discuss the transformation of obstetrics. During the meeting, a director of obstetrics with over 20 years of experience burst into tears while speaking. She said that the obstetrics department in their hospital had recently been closed down. While the hospital was undergoing renovations, the director, who had never been satisfied with the obstetrics department, took advantage of the renovation period to shut down the obstetrics department, and the entire department was gone. Recently, the topic of the wave of closures in Chinese obstetrics has become a hot topic. Previously, news of a wave of kindergarten closures had already swept the internet. A media outlet in China conducted some detailed investigations on this topic. Midwife Nurse Chen gradually discovered that the delivery room where she worked was not as busy as before. Sometimes, she might not even see a baby born in a day, whereas 7 or 8 years ago, she would be called back to the delivery room at any time, busy round the clock, sometimes unable to distinguish whether it was day or night outside. According to data released by the National Bureau of Statistics of China in February this year, the total number of births in 2023 was 9.02 million, less than half of the total number of births in 2016. The rapid decline in the birth rate has directly impacted obstetrics. Since last year, news of the closure of obstetrics departments in some hospitals has occasionally struck a nerve among the public. What makes maternity care practitioners feel extremely anxious is not just the halving of delivery volume. According to the existing assessment system, the more difficult and critical patients a department treats, the more major surgeries it performs, the higher its score and ranking in the entire medical system, and the more resources and support it receives. However, what obstetrics values most is the safety of both mother and child. It encourages natural childbirth and avoids surgery as much as possible. If minor surgeries can solve the problem, major surgeries should be avoided. This has led to obstetrics being awkwardly positioned in hospital assessments, increasingly marginalized within the system. As the income of obstetrics medical staff declines, how to increase the attractiveness of obstetrics, recruit excellent obstetricians, and ensure the sustainable long-term development of obstetrics are concerns for obstetric experts. Renowned obstetrician and gynecologist, Professor Duan Tao of the First Maternal and Child Health Hospital of Shanghai, has issued a call to save obstetrics, which has resonated with many obstetrician colleagues. The number of deliveries was halved. Chen's Hospital is a second-tier comprehensive hospital in the Pearl River Delta region. In her memory, in the first few years after the universal two-child policy was implemented in 2016, it was the busiest time she had experienced in her career. It was normal for the delivery room to deliver 7 to 8 babies in a day, and sometimes the highest number of deliveries in a day could reach 17. Medical staff sometimes got so busy that they couldn't even have time to eat. In 2016, after the implementation of the universal two-child policy, the total number of births in the country reached 17.86 million, a significant increase from 16.55 million in 2015. In order to alleviate the situation of bed shortage caused by the production of the second child, many hospitals at that time increased the number of delivery beds and expanded the medical staff. At that time, the First Maternal and Child Health Hospital of Shanghai had more than 90 obstetricians. There was a saying among the medical staff called the menstrual index, which meant that young resident doctors had to rotate shifts. When they rotated to the obstetrics department, they stopped menstruating, but once they returned to the gynecology department, it became normal again, indicating the intensity of work and pressure. Zhang is a doctor at a maternal and child health hospital in the East China region. In 2016, she transferred from the delivery room to the outpatient department. She actively chose to change positions because of the long-term work pressure and physical exhaustion. One night, I had to continuously resuscitate 2 high-risk pregnant women. Although both rescues were successful, I still had lingering fear afterwards because any decision made at that time could have affected others. Working in the delivery room, before the age of 35, you may not feel very tired, and your body can still cope. But after 35, the body easily becomes fatigued. For example, working a night shift, even if nothing major happens during the shift and you have time to rest in the second half of the night, you still feel exhausted the next day because you don't sleep well, your nerves are tense, and you always worry that someone will call you or the phone will ring, Zheng said. However, this wave of policy dividends did not last for too long. From 2017 to 2023, the total number of births in the country showed a decreasing trend year by year, with figures of 17.23 million, 15.23 million, 14.65 million, 12.00 million, 10.62 million, 9.65 million, and 9.02 million respectively. Duan Tao said that 7 years ago, the hospital's highest annual delivery volume could reach 34,000, but now this number has decreased to between 24,000 and 25,000. Young people who don't want to get married, when the two-child policy was introduced, Duan Tao thought the peak period would last for at most 3 years. There were mainly two types of people who wanted a second child back then. One was those within the system who wanted to have children but couldn't in the past, and the other was older couples who had already had one child. Before the policy was relaxed, families in Guangdong, Honan, Zhejiang, and other places had been having 2 or even 3 children, so there had always been people wanting more children. After the minor peak in 2016, the number of births decreased year by year, reaching 9.02 million in 2023, with a decline of about 10% in some years. In recent years, the number of deliveries at Shanghai Maternity and Infant Health Hospital has ranged from 25,000 to 30,000 cases, with over 26,000 deliveries in 2022. There may be slightly more data in the Year of the Dragon, but it won't increase as much as people imagine. In recent years, China has seen around 10 to 15 million cases of induced abortion each year, with the number staying around 9.5 million in recent years, roughly equivalent to the number of births each year. As the number of women of childbearing age decreases, the number of births and induced abortions is expected to decrease proportionally. Changes in the number of births each year are always the first thing obstetrics departments perceive and are the departments most easily affected by changes in fertility rates. This impact will also extend to the maternity and infant industry. China's maternity and infant industry is worth nearly 5 trillion yuan, making it a significant industry. It will also affect the education and training industries. Many structural changes will occur, but they will take longer to manifest. The pandemic has occurred during a period of declining fertility rates for 3 years, showing a steady downward trend without any additional impact. However, there is one very obvious detail: the number of deliveries in September and October 2023 decreased by at least 30 to 40% compared to usual. Looking back, in December 2022, many people were infected with the novel coronavirus, so there was a noticeable decrease in the number of pregnant women. Shrinking obstetrics. Since the second half of 2023, news about some hospitals shutting down their obstetrics departments has occasionally gone viral on social media. According to incomplete statistics, at least 11 hospitals nationwide have suspended or cancelled delivery services since last year. These hospitals include Zhoushan Traditional Chinese Medicine Hospital in Pingge City, Jiaxing, Zhejiang, Xinzhou Hospital in Guangzhou, Sangnan County Traditional Chinese Medicine Hospital in Wenzhou, Zhejiang Province, and Weiyu Town Health Center in Xiaoyu District, Putian City, Fujian Province. The 5th People's Hospital of Ganzhou City, Jiangxi Province, announced that, according to the hospital's discipline development plan, it would stop providing obstetrics services from March 11, 2024. According to the China Health and Health Statistics Yearbook, the number of obstetrics and gynecology hospitals nationwide decreased from 809 in 2019 to 793 in 2021, a decrease of 16. At the same time, the utilization rate of obstetrics and gynecology hospital beds decreased from 52.24% in 2019 to 44.08% in 2021. For a long time, the fees for obstetric services have not been high. In different regions, there may be some differences in the fee standards, but in any case, among all departments, the fees for obstetrics are relatively low. There are package prices for vaginal delivery and cesarean section, including all hospital delivery expenses, surgery, medications, and consumables. The former usually costs a few hundred to 1,000 yuan, while the latter costs around 2 to 3,000 yuan. Most medications and consumables have no markup, so the department's income mainly depends on the income from delivery surgeries, Duan Tao said. From the perspective of delivery surgery fees, in some areas, the price for vaginal delivery is set at less than 1,000 yuan, and for cesarean section, it's set at less than 2,000 yuan. With the decrease in obstetric deliveries, the operational pressure on obstetrics departments is becoming increasingly apparent. In other departments, Patients usually wait for doctors, but in obstetrics, most of the time, it's the doctors waiting for pregnant women to give birth.
You don't know when she will give birth.
No matter how many babies you deliver in a day, you need to have delivery rooms and operating rooms open 24 hours a day. You need obstetricians, neonatologists, anesthesiologists, and midwives available 24/7. The obstetrics department operates on a 3-shift basis per day, which means that there must be at least 10 people on duty per shift. As a result, the operating costs and labor costs of the obstetrics department have remained high for a long time, said Duan Tao. Taking the Zhejiang Province Basic Medical Insurance Medical Service Items Catalog, 2023, published by the Zhejiang Provincial Medical Security Bureau as an example, the provincial level price for single-birth vaginal delivery is 900 yuan, while cesarean section is 1488 yuan. Duan Tao said that under the condition of limited obstetric fees, the delivery volume must be large enough to cover costs. Originally, when the delivery volume was large, it was based on sacrificing the rest and health of medical staff to keep the department from losing money. Now that the delivery volume has decreased, the department faces the challenge of operating at a loss. Obstetric fees may face restrictions from maternity insurance or DRG value-based payments. Li Xiaomao, former member of the Standing Committee of the Chinese Society of Obstetrics and Gynecology and chairman of the Guangdong Provincial Medical Association Obstetrics and Gynecology Society,
now head of the Department of Obstetrics and Gynecology at Sun Yat-sen University Third Hospital and
professor, said that comprehensive hospitals have maternal and child care centers, where there are more severely high-risk pregnant women. These pregnant women have many complications and complex conditions, and even if they are settled according to the severe high-risk method, the hospitalization, diagnosis, and treatment costs are easy to exceed the reimbursement limit of maternity insurance.
If the reimbursement amount of maternity insurance exceeds the limit, hospitals and departments may need to bear corresponding penalties. In medical insurance DRG, diagnosis-related groups, payment, the value of obstetrics is relatively low. For example, threatened abortion, pregnancy vomiting, etc. These hospitals do not receive high reimbursement from medical insurance, but these patients have a long average length of hospital stay and many examination items, so it is easy to exceed the upper limit of DRG reimbursement, Li Xiaomao said. Li Xiaomao said that if the obstetrics department delivers more than 100 babies per month, the operation of the entire department will be in good condition. Generally, if the obstetrics department cannot reach a monthly delivery volume of 50 babies, it will be difficult to cover the normal operating costs of the entire department. With the decrease in obstetric delivery volume, the salaries of medical staff are being affected. An unnamed obstetrician said that among the sources of income for the obstetrics department, subsidies from the hospital level are very few, and most of them rely on the department's own income. In the salaries of medical staff, mainly including basic wages and bonuses, the bonuses account for the majority.
In 2016, during the peak period of childbirth, it was common for doctors to receive tens of thousands of yuan in bonuses every month, and even more. Nowadays, with the decrease in delivery volume, some doctors' bonus income is only 1 or 2,000 yuan.
The salaries of medical staff are linked to their ranks.
After the decrease in delivery volume, the most severely affected are those low-ranking doctors and nurses. Unwinnable assessment competition. With a significant decline in delivery volume, obstetrics departments at all levels are feeling the pressure. The hospital where Zhang works is a second-tier specialized maternal and child health hospital.
My hospital is simultaneously facing competition from second-tier comprehensive or large tertiary hospitals.
In order to retain more pregnant women, in recent years, the hospital has implemented more humane measures, such as shifting focus from merely delivery to emphasizing prenatal prevention and postnatal care. These initiatives have required a significant investment in medical resources. As doctors, we have also been continuously updating our medical knowledge. In the competition for pregnant women with large hospitals, small hospitals are at a disadvantage, but large hospitals also have their own concerns, namely the pressure brought by the national assessment. The National Assessment is a performance assessment initiated by the National Health Commission 5 years ago for tertiary public hospitals, aiming to guide tertiary public hospitals to admit more complex and critically ill patients. At the local level, the results of performance assessments are linked to the allocation of financial funds, total salary determination, medical resource planning, hospital evaluation, medical insurance policy adjustments, leadership appointments, and rewards. Major project construction, research support, and excellence evaluation. Two key indicators reflecting the technical difficulty of medical services are the Case Mix Index, CMI, and the proportion of fourth-level surgeries among discharged patients. The higher the CMI value, the greater the difficulty coefficient of the cases treated, indicating a higher difficulty coefficient of admitted patients. However, in obstetrics, the CMI value and the proportion of fourth-level surgeries are not high. Yang Huixia, Director of Obstetrics and Gynecology at Peking University First Hospital, said that fourth-level surgeries in the field of obstetrics are very rare. For example, rescuing a pregnant woman with dangerous placenta previa accompanied by placental implantation hemorrhage, if successful and the uterus is preserved, cannot be classified as a fourth-level surgery. But if the uterus is removed, it belongs to a fourth-level surgery, which obstetricians cannot do. Firstly, because it is against medical professional ethics, and secondly, it does not conform to the concept of encouraging childbirth. The original intention of the national assessment is good. The purpose is to guide tertiary public hospitals to develop with high quality, admitting more complex and critically ill patients and performing more major surgeries. The problem is that the majority of pregnant women that obstetrics departments face are not patients. The development concept of obstetrics requires obstetricians to provide prenatal care through screening assessments and take a series of preventive measures to minimize complications until safe delivery. However, the CMI value indicator rewards more complex rescue cases, with higher scores given for rescuing severe cases like severe preeclampsia. This runs counter to the development concept of obstetrics, said Yang Huixia. In December 2019, West China Medicine published a study titled Evaluation of Clinical Department Operations in a Hospital based on a comprehensive evaluation model. The study involved a large tertiary A-level comprehensive hospital that integrates medical, teaching, and research. The results showed that in terms of surgical evaluation, the highest score in terms of technical difficulty was in cardiac surgery, while obstetrics and gynecology, ophthalmology, and pediatric medical centers scored the lowest. The proportion of third and fourth level surgeries and plastic surgery scored the highest, while obstetrics and gynecology scored the lowest. Researchers from hospitals such as Chengdu Third People's Hospital, Sichuan Provincial People's Hospital, and Chengdu University-affiliated hospital published a study in Chinese medical records in 2021 titled Analysis of Hospitalized Cases of Pregnant Women in a Tertiary Hospital from 2015 to 2020. The results showed that from 2015 to 2020, there were a total of 16,380 patients, and among pregnant women who underwent surgery, first and second level surgeries accounted for the majority, at 93.71%. Li Xiaomao said that the low CMI value in obstetrics in the setting of fourth-level surgeries have not fully taken into account the special nature of obstetrics, which seems unreasonable for obstetrics. Qi Hongba, director and professor of Chongqing Maternal and Child Health Hospital, believes that if a hospital's obstetrics department is constantly rescuing patients every day, it does not necessarily mean that the obstetrics department's level is very high. Obstetrics is a discipline that requires a high level of attention to prevention and healthcare, unlike other disciplines. Obstetrics should take preventive measures in advance, reduce pregnancy complications, and ensure the safety of mothers and newborns. From the perspective of comprehensive hospital managers, the obstetrics department not only does not contribute to the hospital's ranking, but the larger it is, the lower the hospital's ranking will be. As a result, hospitals may not support the development of obstetrics. Not only comprehensive public hospitals' obstetrics departments face such development pressures, but specialized maternal and child health hospitals also face the same situation. Specialized hospitals like ours, which focus on maternal and child health care, are also involved in the national assessment. The larger the obstetrics department becomes, the lower the hospital's ranking will be. Some specialized hospitals have shrunk their obstetrics departments and turned to focusing on the development of gynecology and pediatric surgery, which allows their CMI values to increase. As a hospital manager and an obstetrician myself, I will continue to care about and support the development of our obstetrics department without hesitation. However, some of the current indicators of the national assessment are not favorable for the development of obstetrics and may undermine the confidence of our colleagues in developing obstetrics, said Qi Hongba. Qi Hongba believes that some hospitals' assessment of the proportion of inpatient surgeries has led to an increase in the cesarean section rate, which is not reasonable. After all, cesarean section is risky.
Currently, the global trend is to encourage vaginal delivery and control the cesarean section rate. Challenge of talent drain. The health of women and children is the cornerstone of national health, reflecting the overall health level and social civilization of a country.
With the significant decrease in maternal and infant mortality rates in China, this reflects the government's emphasis and multi-party efforts.
However, while maintaining these achievements, the training and retention of obstetricians and gynecologists has become a focal issue.
With the development of medicine and social progress, obstetrics faces significant risks, and any accidents may lead to serious medical disputes.
For operational and safety reasons, some hospitals may be reluctant to retain obstetrics and may even be forced to downsize the department.
In such cases, insufficient business volume can lead to a decrease in doctors' income, making it difficult to retain doctors, leading to a vicious cycle. The overall level of compensation for obstetricians is also decreasing due to a decrease in the number of deliveries and a corresponding decrease in departmental revenue. Young doctors' bonuses may only be a few thousand yuan. In the long run, this will lead to an unstable talent pool and is detrimental to the long-term development of the discipline. In addition, due to adjustments in the fertility policy, the proportion of elderly pregnant women and women with scarred uteruses becoming pregnant again has increased, leading to an increase in complications and comorbidities during pregnancy. This poses higher medical risks to obstetricians, who need to master more knowledge and skills. In this situation, fewer and fewer medical students are willing to choose obstetrics as their career direction, posing a challenge to the training of obstetricians. This has also attracted the attention of hospital leaders, who believe that they should not only focus on hospital management but also consider talent cultivation. In order to retain talent and maintain a stable workforce, some obstetrics and gynecology hospitals have begun to take proactive measures. They focus on improving service quality, enhancing working environments, strengthening postpartum care, and newborn services. Additionally, some obstetrics and gynecology hospitals offer high value-added services such as postpartum care centers to increase revenue. Some specialized hospitals have even established international outpatient departments to increase outpatient fees in response to the challenge of talent drain.